Hey, welcome to our Tuesday Talk. This Tuesday Talk was inspired by a group of recent BC grads. BC is Benedictine Military Academy here in Savannah, Georgia. And these fine young gentlemen asked me, what am I going to talk about? So I'm going to thank, first of all, my son, Tony Paletta, Walker Barlow, Brent Aliota, and Michael Carter for inspiring me about today's talk. We're going to talk about surgery that is more common in the adolescent age group, because generally speaking, we don't do cosmetic surgery on adolescents or young adults. There are some exceptions. The common surgeries that are requested in this age group are otoplasty to fix prominent ears, rhinoplasty to fix problems with the nose that could be either breathing or the way the nose looks, and gynecomastia. And what gynecomastia is, male breast. And I'm not implying that any of these kids have any of these conditions, but we're going to talk about those things since that's my source of inspiration. Okay, so males normally go through a pattern where they develop breasts. It can develop when they're really young, like babies, and some children redevelop it in puberty and it doesn't necessarily go away. And then of course older men in their later years, 70s and whatnot, may develop breasts. So the breast is actually caused by that. There's actually a firm glandular breast, but there also can be an element of fatty tissue, and that's where you have to distinguish it. Is a true gynecomastia where there's breast tissue or just fatty tissue? If it's fatty tissue, you may be able to treat that with liposuction, but true gynecomastia, you have to remove the gland. Now, if you just remove the gland underneath the nipple, you're going to have a saucer-like deformity. So you can imagine if you look at somebody's chest, it's going to be sunken in underneath the nipple, look like a coffee saucer. So in order to avoid that, what I like to do is I like to tackle both problems. I like to remove the gland, but I also want to treat the surrounding area with liposuction so that you get a smooth shape to the chest wall. Okay. That usually means an incision underneath the nipple and a small incision to do the liposuction. Men recover quite well from this. This is also a surgery that is common in men in their 20s, 30s, and later. But it's one of those things that we do for the adolescent age group, high school age children. And thank you for listening to the Tuesday Talk. We're going to cover some of those other issues, rhinoplasty and otoplasty, in future talks. And go BC.